I've been told that I'm going to be the first practitioner of the Wiley Protocol in the Commonwealth of Virginia. I actually tried to convince a couple other doctors to join me at this seminar, but they're a little afraid. And also 2 pharmacies in the Commonwealth of Virginia too, but they get too much profit from Trias and Bias to want to do this. So I'm working with a pharmacy in Maryland at this point. But I expect to change things when they see my point. I have a bunch of patients that at doctors that I'm teaching homeopathic medicine nutritional therapy, so when I introduce this into the whole milieu, I think they're going to get turned on. I've been doing bioidentical hormone replacement therapy for almost 2 decades, using the Dr. Lee's approach and others, and trying to cycle it as best as I can. But I was always uncomfortable not having real clear-cut science with what I'm doing, because I practice constitutional homeopathic medicine, and it's very precise, where we gather a great deal of physical, emotional, mental data in order to find the precise homeopathic prescription that really will be transformative in their health and well-being. And I didn't feel an equivalent science empirically with hormone replacement therapy. And some women did okay, and I had to modulate their hormonal therapy with homeopathic therapy and nutritional therapy. So it wasn't just simply giving the hormone and they were fine. There was always symptoms to modulate. And some women just did terribly. And it was hard to figure out how to do this correctly. And one of my patients, I have a lot of very sophisticated patients, fortunately, one of them is a professor, and was looking on the internet, found this and sent me the website, and I looked at it and said, whoa, this is interesting, a real scientific approach to hormone replacement therapy that made sense because of the periodicity and cyclicity of it going according to the natural cycles is very much what I do with nutritional therapy and homeopathic medicine. So I figured, well, maybe this is the way to go with hormone therapy. I certainly am very impressed with the wealth of knowledge that Ms. Wiley has of endocrinology. She's actually, her wealth of knowledge and her grasp of endocrinology and how it fits into the universal patterns is far more profound than any endocrinology professor I've ever dealt with. And it puts them all to shame. And it also brings into a practical application a lot of the medical physiology on endocrinology I read in the textbooks, and makes it make sense. Because a lot of it is very static. And it really doesn't tell you, okay, here's the information, here's the data on how the levels cycle, but you don't know how to do it, what to do with it. This is a practical application of the true empirical science, which is that's the kind of medicine I like to practice, what really works, rather than a superimposition of what Big Pharma wants you to practice. My interest in is being able to combine this very precise, rhythmic, biomimetic hormone therapy with constitutional homeopathy, which is you have the bioenergetic stimulation, very specific bioenergetic stimulation on a mind-body-spirit plane, along with biochemical, biohormonal stimulation, and bringing them both into balance, ideally to achieve optimal health and well-being. I'm really looking forward to interfacing with other physicians who are using this protocol and just standardizing it so that we really know what we're doing, and being able to have a definitive protocol to work by that everyone's using at the same level, and you gather enough research and clinical data that we can present it to the medical profession and to the government and say, hey, this is the way to go. This is the way to be able to deal with a lot of chronic diseases we haven't been able to master. I've heard anecdotes of some of my colleagues in Texas and other states who have been treating patients with severe autoimmune diseases, rheumatoid arthritis, lupus, multiple sclerosis, that they put them on the Wiley protocol and they saw dramatic results. So I treat a lot of autoimmune diseases and malignancies, and I really am looking forward to seeing how the combination of introducing the Wiley protocol into the protocols I'm already using homeopathic nutritionally increases the benefit overall.
I tried Premarin and Provera, but I just didn't feel good on it at all. And there were lots of kind of red signals, red flashing lights about how maybe it wasn't so good. And it turned out that that was true. I read the book, and the book is very complicated, but I read it twice. And so I thought that it sounded very interesting, and it was bioidentical, natural hormones, and I'm very much into that kind of movement, so that's the reason I chose it over other forms of protocol. The main benefit, I guess, is, just immediately no more hot flashes. I didn't have that badly, but they were irritating, and so it was better. I also have been diagnosed with osteopenia, and so now I'm normal. The bone density is normal. Libido was low, and now it's normal. So those were the three main benefits that were real obvious. There was one that wasn't so obvious, and that was that at one time, for years, anytime I would sit down for a period of time to stand up, I would have a little bit of pain and have to stand and wait, and that just went away. So I'm assuming that that might be one of the benefits. What I really like about it is the fact that it's measurable, and so therefore if you're not feeling good, and we're part of this process, in other words, how we feel is a very big important part of it, and so we can tweak it, and we can either raise the amount of hormone that we're getting or lower it, and we can tailor it to our own needs, and I think that's really important. I like being part of that process, and it's not easy to do that with a pill. The fact that these are measured in very small dosages, I think, is very important. I feel healthier. I guess how you feel is a measure of how healthy you are, and so if that's true, then I feel healthier.
Knowing how important hormones are, I attended this lecture, and I am astounded with what I've learned. The circadian rhythm, the ability to work with nature. And I've interviewed patients who have been on this program, and the results that they have are really incredibly effective. It's changed their life. Laymen and doctors must open their eyes and understand that there's an option out there that appears to be better. By appear, the results are in the pudding. Just talk to the patients who are on it, and you will see amazing results, who have been on other systems where it didn't do the job for them.